So class, again I am here with the continuation of my presentation bones and its classification. I have already explained you about the different shapes of the bones and its classification and their locations, and I have already explained you about the regional classification of the axial skeleton and the locations of the bones of the axial skeleton. Now I am going to discuss with you about the appendicular skeleton, that is the second regional classification of the bone. So the appendicular skeleton consists of the bones of the shoulder girdle, upper limbs, pelvic girdle, or the lower limbs. Here you can see the blue part that is representing you about the appendicular skeleton through this diagram. So the appendicular skeleton consists of the bones of the pelvic girdle. The pelvic girdle is the bone that provides connection between the trunk and the lower extremities, and the pelvic girdle consists of the two hip bones, and each of the hip bone is also called these are the two hip bones, and each hip bone is also called as the innominate bone because it is the fusion of the three bones, which is known as the ilium, this part, and the scium, this part, and the pubis. This is the pubic bone. So these three bones are fused together to make the each hip bone, which is also known as innominate bone. And the pelvic girdle consists of the two hip bones. Or now scapula, which is the next bone, and it is the bone which lie at the back of the thorax, and it forms the posterior part of the shoulder girdle. Then the clavicle is also known as the collar bone, and it is the long and curved bone, and it forms the anterior part of the shoulder girdle. The scapula forms the posterior part of the shoulder girdle, and the clavicle forms the anterior part of the shoulder girdle. Now comes to the another another bone that is known as humerus. Humerus is the longest bone of the upper limb, and it contains a shaft and two extremities. I will further explain you with the help of the diagram in my another slide. Ulna is the innermost bone of the forearm, and it also contains two extremities and a shaft. And then the radius is the lateral or outermost bone of the forearm, and it contains two extremities and a shaft. And now comes to the wrist bones. Wrist bones are composed. Wrist is composed of the 8 small bones that are known as the carpal bones. Here you can see the scapula, which forms the posterior part of the shoulder girdle, and this is the clavicle, which is a long and curved bone, and it forms the anterior part of the shoulder girdle. And this is the humerus, which is the long bone part of the upper limb, and it consists of the shaft. You can see it consists of the shaft and two extremities. These are the two extremities. And now comes to the ulna. Ulna is the innermost bone of the forearm. This is the ulna, and this is the radius. Radius is the outermost bone of the forearm. They also these radius and ulna has shaft and the two extremities. These are the two extremities of the each bone of radius and ulna. Then the wrist bones are known as the carpal bones, and it consists of 8 small bones. So this is the diagrammatic presentation of the these bones of the appendicular skeleton. Now comes to the bones of the palm. The bones of the palm are made up of the metacarpal bones, and they are long bones which contain a head, a shaft, and a base. The base is articulate with the distal row of the carpal bone. Then the bones of the fingers. Bones of the fingers are made up of the phalangeal bones, and the thumb has 2 phalanges and the other fingers have 3 phalanges, and they are proximal phalanges and the middle phalanges and the distal phalanges. Here you can see the fingers with the 3 phalanges: distal phalanx, middle phalanx and proximal phalanx. This is the thumb, which has distal phalanx and the proximal phalanx. And these are the phalanges of the fingers. As I have told you about the metacarpals, metacarpals are the bones of the palm. Here you can see the metacarpals. These are the bone of the palms and these are the bones of the fingers. Now comes to the bones of the lower limb. I have already discussed with you about the bones of the forearms, and now I am going to discuss with you about the bones of the lower limb. The lower limb consists of the femur, patella, tibia and fibula. The femur is the bone which is also known as the thigh bone, and it is the longest and the strongest bone of the skeleton, and it articulates with the 2 bones of the legs. The larger is the tibia and the smaller is the fibula. The patella I have already discussed with you in my first part of the presentation, that it is the type of the bone that is known as the sesamoid bone, and it is present between the knee joint and the then comes to the tibia. Tibia is the innermost bone of the leg, and it is the long bone which contains the 2 extremities and a shaft. And then the fibula is the outermost and the lateral bone of the leg, and it also contains the 2 extremities and a shaft. And the bones of the foot are classified as tarsal bones, which consist of the 7 bones, and the metatarsal bones, which are 5 in number, and the phalangeal bones are 14 in number. Here is the diagrammatic presentation of the lower limb bones. The foot bones, which consist of the 7 tarsal bones, 5 metatarsal bones and the 14 phalanges. The first bone is the femur, which is the strongest bone of the lower limb, and this is the patella, which is present between the knee joints or kneecap, which is the type of the sesamoid bone, and then tibia, innermost bone of the lower limb, and then the fibula, outermost bone of the lower limb. Tibia and fibula has a shaft and 2 extremities. Here you can see it. So this is all about the bones of the lower limb. So class, I am done with my presentation of bones and its classification. I have discussed with you about the different shapes of the bones and its classification on the basis of the shape, and then I have discussed with you about the regional classification of the skeleton or the bones, axial skeleton and appendicular skeleton. In detail, I have already told you about their locations, about their shapes and their functions, and hope you all have got my points of this presentation. And if you have any questions, then you can ask me anytime through my WhatsApp group or LMS. And good luck for your future. Thank you so much.